Have you or a loved one experienced sudden temporary symptoms like numbness, confusion, or vision problems? It could be a mini stroke, also known as a transient ischemic attack, TIA. Stay tuned until the end for a special bonus that could save a life. Hello, today we'll take an in-depth look at the 10 warning signs of mini strokes in the elderly. Mini strokes, or TIAs, are often precursors to a full-blown stroke, so recognizing these signs is crucial. We'll explore each symptom backed by the latest research and provide actionable advice on what to do if you or a loved one experiences these warning signs. Remember to like and subscribe for more valuable health content like this. Warning sign number 1. The first warning sign is sudden numbness or weakness in the face, arm, or leg, especially on one side of the body. A 2021 study published in the Journal of Stroke found that 70% of TIA patients experience this symptom. This happens because a TIA temporarily blocks blood flow to specific areas of the brain, affecting the body parts controlled by those areas. If you notice this, seek medical attention immediately, as it could be a sign of a more serious stroke. Don't wait to see if the symptoms go away on their own. Every minute counts when it comes to stroke treatment. Warning sign number 2. Sudden confusion, trouble speaking, or difficulty understanding speech is another red flag. A 2022 study in the American Journal of Emergency Medicine reported that 60% of TIA patients had speech disturbances. This can manifest as slurred speech, difficulty finding the right words, or trouble understanding others. The reason behind this is that the language centers of the brain are not getting enough blood flow during a TIA. If you or a loved one experiences this, don't wait. Get help right away. Even if the symptoms seem to resolve quickly, it's essential to get a medical evaluation to prevent a more serious stroke. Warning sign number 3. Sudden trouble seeing in one or both eyes can also indicate a mini stroke. The National Stroke Association states that 44% of TIA patients experience vision problems, such as blurred vision, double vision, or even temporary blindness in one eye. This occurs when the blood vessels supplying the visual centers of the brain are affected by the TIA. Don't dismiss sudden vision changes as a normal part of aging. It could be a sign of something more serious. If you experience vision problems along with other TIA symptoms, seek immediate medical attention. Warning: sign number 4. Sudden trouble walking, dizziness, loss of balance, or lack of coordination are also warning signs. A 2023 study in the Journal of Neurological Sciences found that 50% of TIA patients reported balance issues. This happens when the TIA affects the areas of the brain responsible for balance and coordination. You might feel like the room is spinning, or you may stumble and have difficulty walking straight. If you notice these symptoms, sit down and call for help. Don't try to tough it out or wait for the symptoms to pass. Prompt medical attention is essential. Warning sign number 5. A sudden severe headache with no known cause can also be a mini stroke symptom. The American Stroke Association reports that 30% of TIA patients experience headaches. This type of headache is often described as a thunderclap headache. It comes on suddenly and reaches maximum intensity within seconds to minutes. It may be accompanied by other TIA symptoms like vision changes or numbness. Don't ignore a sudden unusual headache. Seek medical advice promptly. While not all severe headaches are caused by TIAs, it's better to be safe than sorry. Warning sign number 6. Sudden nausea or vomiting accompanied by other symptoms like numbness or vision changes could indicate a TIA. A 2022 study in the International Journal of Stroke found that 20% of TIA patients experienced nausea. This happens when the area of the brain controlling digestion and nausea is affected by the temporary loss of blood flow. Pay attention to any sudden, unexplained symptoms, especially if they occur alongside other TIA warning signs. If you experience sudden nausea or vomiting with no apparent cause, along with other neurological symptoms, seek medical help right away. Warning sign number 7. Brief loss of consciousness or fainting, also known as syncope, can be a sign of a mini stroke. The Centers for Disease Control and Prevention (CDC) states that 10% of TIA patients experience syncope. This occurs when the TIA affects blood flow to the areas of the brain responsible for maintaining consciousness. If you or a loved one faints, it's crucial to seek medical evaluation to rule out a TIA or other serious conditions. Even if the person regains consciousness quickly, it's essential to get checked out. A TIA can be a warning sign of a more severe stroke in the future. Warning sign number 8. Sudden difficulty swallowing or dysphagia can indicate a mini-stroke. A 2021 study in the journal Dysphagia found that 15% of TIA patients experienced swallowing problems. This happens when the TIA affects the areas of the brain that control the muscles involved in swallowing. You might notice that food or liquid seems to get stuck in your throat, or you may cough or choke while eating or drinking. If you notice sudden changes in swallowing ability, don't ignore it. Get checked out. 1. Swallowing difficulties can lead to serious complications like aspiration pneumonia if left untreated. 2. Warning sign number 9. Sudden changes in behavior such as increased confusion, agitation, or sleepiness can be a TIA warning sign. 3. The National Institute of Neurological Disorders and Stroke reports that 25% of TIA patients experience behavioral changes. 4. This occurs when the TIA affects the areas of the brain responsible for cognition, emotion, and arousal. You might notice that a loved one is suddenly more confused than usual, has difficulty focusing, or seems strangely agitated or sleepy. If you notice unusual changes in a loved one's behavior, seek medical advice. These changes could be a sign of a TIA or another serious neurological condition. Warning sign number 10. Sudden, unexplained fatigue or weakness, especially when accompanied by other symptoms, could be a mini-stroke. A 2023 study in the journal Frontiers in Neurology found that 40% of TIA patients reported fatigue. This happens when the TIA affects blood flow to the areas of the brain responsible for energy and arousal. You might feel suddenly exhausted, as if you can't keep your eyes open, or you may feel weak and unable to complete simple tasks. Don't dismiss sudden fatigue as just being tired. It could be a warning sign. If you experience sudden, unexplained fatigue along with other TIA symptoms, seek medical attention right away. Now, as promised, here's your special bonus: the FAST method for recognizing stroke symptoms, plus some additional tips. FAST stands for Face. Ask the person to smile. Check if one side of the face droops or appears uneven. Arms. Ask the person to raise both arms. See if one arm drifts downward or seems weaker. Speech. Ask the person to repeat a simple phrase. Check if their speech is slurred, garbled, or difficult to understand. Time. If you observe any of these signs, call 911 immediately. Time is critical in stroke treatment. Every minute counts. In addition to the FAST method, here are some other tips for preventing and responding to mini strokes. Know your risk factors. High blood pressure, high cholesterol, diabetes, smoking, and a family history of stroke can all increase your risk of TIAs and full-blown strokes. Talk to your doctor about managing these risk factors. Make lifestyle changes. Eating a healthy diet, exercising regularly, quitting smoking, and limiting alcohol intake can all help reduce your stroke risk. Take medications as prescribed. If your doctor has prescribed medications for high blood pressure, high cholesterol, or other stroke risk factors, take them as directed. Act quickly. If you or someone else experiences TIA symptoms, don't wait to see if they go away on their own. Call 911 immediately and say that you think someone is having a stroke. By remembering the FAST method and these additional tips, you could save a life, maybe even your own. In summary, the 10 warning signs of mini strokes in the elderly are sudden numbness or weakness, confusion or trouble speaking, vision problems, trouble walking or loss of balance, severe headache, nausea or vomiting, brief loss of consciousness, difficulty swallowing, changes in behavior, and unexplained fatigue. If you experience any of these symptoms, seek medical attention immediately, even if the symptoms seem to resolve quickly. Remember the bonus FAST method for recognizing stroke symptoms: face, arms, speech, and time. And don't forget the additional tips we discussed: knowing your risk factors, making lifestyle changes, taking medications as prescribed, and acting quickly if you suspect a stroke. Share this information with your loved ones. It could make a life-saving difference. Thanks for watching. I hope this in-depth look at mini-stroke warning signs has been informative and empowering. Remember, knowledge is power when it comes to your health. If you found this video valuable, please like and subscribe to our channel for more essential health tips. And if you have any questions or topics you'd like us to cover in future videos, leave them in the comments below. Take care and stay healthy.